Hello, everyone. My name is Adam Page. Welcome to the Monkposium Medical Monks webinar series. We have a very special guest with us today, Bryan Groleau. He is the Director of Clinical Education for mediUSA. Since 2003, Bryan has treated patients with lymphedema in outpatient and home health settings with a specific focus on lower extremity lymphedema and wound care. And I just want to say welcome, Bryan.
Thank you. Appreciate it.
And I just want to let everyone know really quick before we start the presentation, if you have any questions during the presentation, just go ahead and put them in the chat feed you see over on the right there. There'll be a Q&A session at the end. But I'll just be monitoring that during the presentation, taking notes of questions. So we'll be talking about them at the end. So without further ado, please go ahead, Bryan.
All right. Really appreciate it, Adam. Pull up my presentation here and we can get started. Awesome. All right. Well, thanks everybody for being here today. Welcome. Again, my name is Bryan, and we're going to be talking about compression today. And I'm hoping to give you a couple tidbits on how to, make the best choice for you. There's just a lot of compression out there, a lot more than when I first started my world of compression as a lymphedema therapist, which I'll share with you. But hopefully I can help you and steer you in the right direction on how to make a good choice for yourself. And I'm going to focus on this one product here. You see Circade Juxtalite. So more to come on that. Again, I've been with Medi. This is the company that makes the Circade. And I've been with Medi for 7 years now, and I'm over their education department there. And my background, like Adam said, it's clinical. I've been a lymphedema therapist for 20 years, dealt with a lot of wounds, and so if it's compression, it's kind of my thing. I've been doing it long enough to know. So mediUSA, Medi is actually a company that's global and originated out of Germany. But we have a United States office, and we are located in North Carolina, and we manufacture a lot of the products there. In fact, we manufacture the Circade product, which I'll be talking to you about later. So Medi's been around a long time. We've been around for over 75 years, and we really focus on compression. But we don't just do compression. We do a lot of other stuff as well. You can see some nice images of some compression here, but we also have an athletic compression line. We've got wound care products. I mean, I'm not going to list everything we do here, but we have a pneumatic compression line, like pumps, vascular pumps, and we, of course, manufacture the Circade and other compression. So a lot of stuff we get involved with. My like I said, my wheelhouse is in the compression world. So I'm hoping to share some good stuff with you today. So that brings us to this. And I know this picture, this image, right? This happens all the time, right? I'm sure maybe some of you have even experienced this, but does this look right? When your doctor says, hey, you need to go get some compression, and you're out left on your own to figure that out, this could be what you end up with. Hopefully not. But there's actually a lot of things right about this, even though most of it looks wrong. The garments on this patient are actually good garments. They're quality garments. Actually, they're our garments. They're Medi's products. But it's what happens when you choose the right products for the wrong situation. And this is never what I want to see when I fit somebody to compression. And if you're thinking that this is something that you've got to muscle through, please don't think like that. This is a poor fit and actually can do more harm than good. We want your compression to work well and be safe. And one more thing I'd like to add to this is that if you look at the right leg, which coincidentally shows up on your left side, the left side of the image, this garment was actually measured correctly when the garments were ordered. By the time the garment came in, that leg swelled up. So even though you measured correctly, if you've got fluctuating edema, then these garments aren't going to work for you. So there's basically, I'm painting the picture for you that there's so many different scenarios and things that can happen that, makes compression difficult and hard to know what to choose from. So there's 3 ingredients, or what I call essentials of compression, that you want to look for when you're choosing compression. I'm going to go into them a little bit, but the 3 of them are right here: gradient, dosage, and wall stability. I'm sure you don't know what those words are. Don't worry about it. You don't have to. I'm going to go into them. But let's focus a little bit on one right now. Let's look at wall stability, because that is what's missing from this picture. What we've got, like I said, is actually a good garment. It's a medical grade garment. It's got the right amount of compression in it, and it's got gradient compression, which I'm going to explain to you just in a little bit. But it's missing what we call the wall stability, which is the thickness or what the material of the compression is made from. And this is the solution for it. When you have that third essential or that third ingredient, you have something that's going to fit better, hold better, and actually do its job and do it safely. So we were close on that last set of garments on that patient, but we were missing one ingredient. And this is what can happen if you don't know all of them. So let's break this down a little bit more and see if we can understand what I'm talking about. Like I said, I have 3 essentials of compression: gradient, dosage, and wall stability. And what you're seeing in these pictures here is a bit of a sneak peek at the Circade Juxtalight, which I'll be talking to you about here in a little bit. But let's dive into what these essentials really mean and what they are. First one is the gradient compression, or another term is graduated compression. Basically what it means is, if you look at this image here to the right with the sock and all the little arrows, it's showing you where the compression in the sock or the garment or the product that you're wearing starts. So if you have, say, a 30 to 40 garment, or your doctor says you need a 20 to 30, you will get 20 to 30 compression starting at the lowest part of that sock in the ankle area. And graduated means that pressure is slowly going to reduce as that garment goes up your leg. And what this does is it ensures that you're going to have blood flow, or edema is going to flow from the bottom all its way up, bottom to the top. We have to have graduated compression because we need flow to go from the bottom to the top. We got to fight gravity, and that's what graduated compression means. The object is we're trying to help support the veins, which is what you see in this other image here. A lot of people with vein disease have valves and veins that look like this that need support from compression, and that's what we're trying to do. Give the veins and the lymphatics, if you're talking about lymphedema, give them the support they need. It's got to be graduated. We got to just make sure we're moving that swelling from the bottom on the way up. So that's graduated compression. Then there's this is another image of it. This would be for more like a thigh-high stocking. But once again, you're going to see 100% of that pressure is initiated in the ankle area at the very bottom. As it goes up the leg, it slowly reduces. So the other one we need to look at is dosage. This is the amount of compression. And this is really where most people focus their concerns on. When a physician writes a script for compression, for instance, they'll usually write a number down. You need to have 20 to 30, 30 to 40. Most people land at the 30 to 40 because that's what's indicated for vein disease. But what happens is, if someone gets prescribed a 30 to 40 garment, they try and put it on and they really struggle with that, which can be a real issue, especially with the types of garments we've been looking at so far that I've shown you. They're elastic garments, and 30 to 40 can get difficult to put on. It's definitely true. Some people can get it on, some people struggle. And what happens is, when people struggle, they lower the amount of compression because it's easier to get on. So now they can get something on, but now they've lowered the amount of compression that they need. And really, it's good to understand in this particular subject, when it comes to dosage, it's like a medicine. It's like a prescription. It's like when a physician gives you a diagnosis and he gives you a prescription of medicine, it's a prescription. And that's what compression is for your legs. And so understanding that if you need 30 to 40, it's because that's what's indicated for your level of vein disease or even lymphedema. So you need to get 30 to 40 on. And if you can't get it on, then stay tuned, because I'm going to show you another way that can really help you to get the compression that you need and still get it on. And then wall stability, which we've talked a good bit about. Now, one thing new to this is I've shown you elastic compression socks so far, but I haven't shown you anything that doesn't have elastic or inelastic in it. So what I like to give the image of a dam and there's water behind it, the water behind it kind of being the edema in your legs. And you've got this great wall that's holding all that water back, or maybe your skin is holding that edema back. But at some point, your skin might not be enough. And depending on how much edema there is, depends on what product and what materials you're going to need out of your compression to hold it back, right? So elastic garments are low on the spectrum for how much containment they're going to be able to have. If you don't have edema at all, elastic garments are great. But the more edema you have, the more structure you got to add to the materials that are made out of it. So there's elastic and there's inelastic. And clearly from this image here, you can see elastic is very stretchy. And this picture of the rope, there is no stretch to it. And so we're going to talk about this in terms of how this looks on your leg, what it's doing to your body, what it's doing to your venous return or your blood return. The good thing about elastic garments, they're great. There's a purpose for every type of compression, but the more elastic a garment is, the more low profile it's going to be. Like I'm wearing compression right now, and I'm not going to show that to you because they're in my legs, and I'm not going to be able to do that. But you'd never know it if I was walking down the street that I'm wearing compression, and that's because I'm wearing elastic socks, and they're very low profile. And when you need more supportive materials like inelastic, they are not as low profile, but a lot easier to get on, and you can get the amount of compression that you really need. So some slight differences there. Here's what's going on with your muscles. These are your calf muscles, and that's what we're looking at. If you look at these images closely, we're looking at resting versus working. In other words, resting is what the muscle is doing when you're not doing anything, when it's at rest, and what is the muscle doing when it's working, when it's contracting. And if you look at the red arrows and the black arrows that surround both sides of the muscle, it's the garment, whatever garment you choose, and what is it doing on the limb. And if you've got something that has a lot of elastic and your leg is at rest, well, the elastic has a lot of recoil, so it's kind of going to squeeze your leg while you're not doing anything. And when your muscle's working, if you've got something with a lot of elasticity, it's just going to stretch and kind of go with the flow. And sometimes that's all you need, and that's fine. But the later you get with vein disease, the later stages of vein disease, or if you've got edema or lymphedema, then you need something with more structure and something that's going to have a stiffer wall. So when that muscle contracts and it moves, it's got a strong wall to combat against it. And it helps increase that pressure to move that fluid from the bottom to the top. And so what we're really looking at here is what works in conjunction with the muscle contraction. Again, looking at resting pressure, what is that garment doing against the skin when your muscle's not doing anything? If you've got elastic on, it's going to be recoiling right back onto your skin and kind of causing high pressure. This is why we don't sleep with elastic socks on, because elastic is squeezing on your leg at all times. If you've got something that doesn't have elastic, then there is really minimal recoil, and it makes the resting pressure very low. And the pressure doesn't really kick in until you contract that muscle. And if you contract that muscle with something that doesn't have elastic, it's a nice stiff wall. It increases the pressure during movement, and that's what really is going to increase your blood flow. You can see that kind of here. The idea is, you know, in all of us, whether we're wearing compression or not, you may or may not know this, but the way that your blood is returned to your body isn't from the heart. The heartbeat doesn't help blood get back to the heart. It's movement that helps blood return to the heart. It's all about muscle contraction. And when your muscles move, it squeezes those valves and pushes blood through those. So muscle contraction is incredibly important for all of your blood return to your body. And if you have vein disease or edema, then it's having trouble with that. And that's why we wear compression, to help combat that and get our fluids moving where they need to go. So I've shown you circular knit and flat knit garments. If you remember the first picture I showed you of that really uncomfortable looking garment, that was a circular knit garment. And then what we fit the patient to make it better was a flat knit. Now, both of these have elasticity, but a circular knit garment has way more elasticity than a flat knit. And the flat knit garments are, they're a thicker material, so they're more robust and they have stronger materials. So this is what circular knit can do on a lot of edema. We shouldn't use circular knit garments for patients with a lot of edema. They're really for non-adenomous patients. And then here's your flat knit, right? This is a thicker material. It's still elastic, but it's less. And so it's got more structure, looks way better and more effective. So these are the differences. And this is just our elastic category. But what I want to show you now is, and this is again, that triangle I showed you earlier of the levels of containment with all the different types of compression. So what I want to jump into now is Circade. Circade is inelastic compression. We've moved from elastic, and now I want to talk to you about products that don't have elastic in them. And they're a game changer for people that have edema, people that have late stage vein disease, and especially people that have a hard time getting the right amount of compression on. So Circade at Medi, our mascot is a giraffe. And there's a reason I have a picture of a giraffe on here, and it's because they're the tallest land animal, and they have massive amounts of pressure in their legs, way more than we do when we're standing upright. Yet these animals never swell. It's impossible for them to swell. And the reason for that is because a giraffe's skin is inelastic. And they can survive, they can be this tallest land animal on earth and not have swelling. So our motto is that if we can create something like this, inelastic skin for our patients that suffer with edema and lymphedema and vein disease, then we can be a little bit more like the giraffe and help ourselves out and help patients out. So the Circade Juxtalight, like I said, it's inelastic, and you can kind of see in this picture, maybe you can see that or not, but these are Velcro straps. I'm going to show you a video in just a minute, but here's a couple of the significances of the Juxtalight. One, you can measure the amount of compression that when you put it on. So if the doctor says you need to wear 30 to 40, you can actually set it to the amount of 30 to 40 or 20 to 30 or even 40 to 50. It's definitely far easier to take it on, put it off, put it on, take it off. It's inelastic, adjustable. So that means not only is it easy to get on, but you can readjust the pressure anytime you want. If it's getting loose, if your swelling's gone down because you're wearing it, you can just readjust it. So it's a real good solution for managing edema. So what I want to show you now is a video. And this is about the Juxtalight. I got two videos to show you today, but here's the first one. So I'm sure you've got some questions after seeing that, but hopefully you can see a whole different type of compression that might be a good fit for you in helping you manage your edema, getting it on and off. The idea is increased independence, because garments sometimes are not easy to put on. Again, you heard me talking about how important it is to wear the right amount of compression. So if that's you and you need to wear the right amount of compression, but you can't get the elastic stuff on, this is a good option. If you just have a lot of edema and you have a difficult time managing edema, then this is another good option, because it's going to have the best level of wall stability or containment or material support that you can get. The other thing you're going to get is consistent compression, because guess what? If the pressure goes down or if the swelling goes down while you're wearing it, you can just increase or readjust the compression, which will help reset that compression. So you get to keep really good compression on your limb kind of at all times. It's really good in the wound. Sometimes it's used to help open wounds, open venous leg ulcers or vein wounds, just because of its readjustability and the ability to set it to the right compression level. So some people use this not just for maintenance, but they use it for treatment too. Happens all the time, just because people are bandaged up and they prefer to have something that they can readjust, especially on the weekends. Or if you're going to get bandaged once a week at your doctor's office, you might want to have something that you can readjust through that time. So people switch to this. It just depends on so many things, but it's a really good tool, even in the wound care world. There are two forms of the Juxtalite, and here they are here. There's a Juxtalite, which is the first model that we had of this, and then there's a Juxtalite HD. And really the only two differences, or the only one difference between the two of them, is that the Juxtalite HD is twice as thick as the standard Juxtalite. So both of them are great. They're both inelastic, but the HD is even thicker. So if you have even more edema, then we have something that can really help support that. I usually say if you've got a little bit of edema or no edema, then you can use the Juxtalite. If donning and doffing is just your issue, then the standard Juxtalite is a good choice for you. But if you've got anything more than just a little bit of edema, I would say go for the heavy duty. That's what HD stands for. One more video and then I'll close this up. But this is really just showing you how to put it on and take it off and kind of care for it.
How to apply the Cirque Juxtalite lower leg wrap featuring optional Easy On panel. First, apply the compressive undersock using the heel pocket as a guide. Pull the sock up the leg, making sure it's fully extended and lays smooth with no wrinkles. Now, put on the Juxtalite by slipping your foot through the Easy On panel and up the leg until the top of the wrap is just below your knee. With the Juxtalite in place, unroll the bottom two bands. Pull the bands outward and around the leg at the same time and secure the hook to the wrap. Repeat this step with the top two bands. Once all four bands are secure, make any necessary adjustments for fit. If you're not using the optional Easy On panel, start with the top two bands and work your way down until all four bands are secure. Now, check the Juxtalite and make any needed adjustments that allow the wrap to lay smooth against your leg without any gaps. Set the prescribed compression level with the Cirque BPS card. Align the arrow on the card with the marked line on the wrap and adjust the band tightness until the second marked line falls within the desired compression range. Adjust as needed throughout the day. To remove, unfold the compressive undersock from the top and unhook the bands. Carefully roll the hook tabs onto themselves. Now simply slip off your Juxtalite.
Alrighty, I think that is just about it. One more thing to tell you, and that is there are 16 sizes in the juxtalight, and it's pretty simple to measure for. You just need an ankle and a calf circumference, and then a measurement from the floor to behind the knee, and we can figure out what size to put you in. So that is everything. Thank you, everybody, for paying attention and joining me today. And I'll see if there's any questions that I can help with. I hope that was helpful. And well, yeah.
Hey, thank you so much, Bryan. That was fantastic. As Bryan was just saying, we do have a few minutes for questions here. I'm looking here in the chat. We just got one in from Isaac. He says, "Thank you for the excellent presentation. The problem we experience is being able to order these out for patients. Most of the time, the medical insurance does not cover this, even with a prescription, and it is costly for the patients to pay for them out of pocket. Any suggestions for this?"
Well, I think you have a good solution for paying out of pocket, don't you, Adam?
Yeah, I was going to say this might be more of a me question. Medical Monks carries these products. We source everything straight from Medi, as you might imagine. So we can really get, we have these for the best possible out-of-pocket price. You can always contact us through the website, medicalmonks.com, or through our social media channels. We'll be happy to, set you up with anything you need for your patients.
Good.
Looks like we have another question from Bonnie. She asks, now, I mean, this might be going a little bit along with, we were talking about giraffes earlier. Do you have any experience with compression of wounds on horses? Often they can bleed and lose 10% of their blood. They need instant compression on a wound like this.
Yes. So horses, I've never personally wrapped a horse, although I would like to have that experience, but I have talked to a lot of people that are involved with compression for horses, and a lot of elastic ACE wraps are used. The same kind of rules apply. I mean, I don't really know the anatomy of a horse's leg as well as I do a human, but I can tell you that elastic compression for an open wound, or anytime you're trying to increase blood flow, elastic compression is not really the answer, because it just, like I said, stretches. And if the muscles contract, the elastic compression just expands with it. So you don't get a spike in compression or a spike in pressure. And that's what our bodies need. If you have a spike in pressure, in other words, if the muscle contracts against something that's got a firm wall, the blood has an opportunity to interact with the muscle contraction and move blood and fluid from distal to proximal, or from the bottom of the body. It's kind of the fighting that gravity. So if you can get your hands on inelastic compression, there are inelastic bandages out there. And you're welcome to email Adam, and Adam, you can forward that person's information to me, and I'd be happy to show you where you can get bandages. Again, those bandages are short stretch bandages. They're not elastic. They're intended for human use, and I don't know if they're indicated for horses, but I mean, pretty much everything you do in that world's probably off. What am I trying to say? You're kind of going out of the indications of what it's actually intended for. So you have to be careful with that, but they're pretty safe products.
I have Elizabeth asking, and it kind of dovetails on what we were talking about just a minute ago. That was helpful. Does Juxtalite require a physician's order?
That's a good question. And I believe if somebody wanted to order it from you, Adam, they could without a prescription, correct?
Correct. Yeah. But we are, Medical Monks does sell these items strictly out of pocket. So I guess sort of the short answer.
So they are available without prescription. Usually it's the 30 to 40 where the prescription is warranted. Now, yeah, certainly you can get a hold of these without a prescription. What I would do if you do get a hold of them, check with your physician to make sure 30 to 40 is good for you. I don't know what any other other diagnoses are, comorbidity, stuff like that. And there are contraindications, there are precautions. You just want to make sure with your doctor, hey, I want to wear compression. can I wear 30 to 40? And they'll be like, yeah, go for it. And that's what you want to know. So just make sure it's just to make sure it's safe for you. I mean, typically 30 to 40 is always safe, but there are some times when it's not. So you have to be careful.
I have a question here from Natalie. What do you think about the 3-layer compression with Uniboot?
3-layer compression is good. I like it. I've used it a ton in my career. The 3-layer is the lighter version, so it's at a 20 to 30 level. It is a lot more elastic, so it's not my first preference, but the multi-layers to it are helpful, that make it effective. But the Uniboot itself, it's a very rigid layer. And if that's applied too tightly, which in theory, the correct way to apply an Uniboot is pretty tight, you have not only an inelastic layer, but you have a very rigid layer, and it's too rigid. So you have to be careful. Like when I did Uniboots, I would pleat the Uniboots. In other words, so that they would have room to expand. I don't use the actual Uniboot for compression. I use the 3-layer wrap for the compression. I use the Uniboot for the zinc and the skincare of it. But I have used Uniboots under Juxtalights. So there's that option too. To me, it's all about getting the Uniboot on the leg, not for compression. The 3-layer is a good compression choice, but there are other ones too, and a Juxtalight could easily be one of those.
I have a question here from Vivian asking about some other Circade products. She says, please compare Circade single band easy ankle foot wrap with Circade Juxtalight ankle foot wrap.
So the Easy Band is a single band. It's a bandage. It's a short stretch elastic bandage. And it's good because it's easy to put on, but it's not easy for a patient to put on necessarily. It's a good choice for a clinician if they're wanting to put that over a foot. The Juxtalight ankle foot wraps, those are different. Those are Velcro. They're adjustable. They're inelastic, and they're typically easier for a patient to handle and manipulate to put on than an Easy Band. An Easy Band it's a big roll. You've got to roll it up. You've got to put it on, and if you need to readjust it, you got to take the whole thing off and rewrap. It's a great product. It's a great choice. But if I was a patient, I would rather have something easier and adjustable. To me, I'm all about adjustability because it lets you control things better.
I do have a question here from one of my Medical Monks colleagues. She asks, can Circade Juxtalight be washed and reused? If so, how?
It can actually, and you should definitely wash it. You can put the Juxtalight in like a mesh bag and throw it in the washing machine. You obviously want to put it in that mesh bag to protect it, but you also want to make sure, and if you saw in the last video of them removing it, they always remove the straps and fold them back on themselves because you don't want pet hair or any kind of stranglers picked up on that Velcro, because when you do, it's gonna wear the Velcro down and it's not going to stick as much. So your whole goal is to really kind of protect that Velcro. But then drying it, I would not dry it in the dryer. I would lay it flat to dry. But there are 2 liners that come with it. So you have one liner to wear and one to wash, so that you can typically wash the Juxtalight less.
All right, and one more from the monks. Is Circade Juxtalight safe to sleep with?
Yes. Oh my gosh, thanks for asking that question, because I started to talk about this in my presentation. I said elastic socks should not be slept with because they have a lot of resting pressure. And when you switch to something that doesn't have elastic, remember there's not going to be resting pressure because it's really minimal recoil. And so yes, Juxtalight's Circade products are meant to be worn day and night. You can wear them around the clock. So they are safe for sleeping in. So if that's something you need to do, absolutely choose that. Some people use these just for night, and then they go into a circular knit garment by the day, right? Because like you heard me say, the circular knit socks are less profile, right? You can wear them and no one would know you're wearing them, but they still tend to, you might still swell during the day. So some people switch to the Juxtalight at night and keeps everything in balance.
All right, we have time for one or two more. We have another one here from Isaac. He asked, how often does it need to be replaced, or is it good for life?
The Juxtalights are good for 6 months. We guarantee the compression level to be accurate and effective for 6 months. I've seen them last a lot longer than that, but depending on how many dogs and cats you've got and how well you take care of your product, it's all about the Velcro. It also depends on how much stress is on the garment itself. I mean, if you're using it for, say, treatment and not maintenance, and you're trying to really treat and reduce swelling with it, you might not get as long out of it. If it just depends on really the severity of your symptoms. And if there's a lot of edema, you might have to replace it more often. But if you don't have edema and you're, keeping it clean, you should be able to get 6 months out of it. And they're warranted to last that long, at least. And I see them last a lot longer than that. So
I see another one from Vivian. Will Circade PAC band system work well with the lower leg Juxtalight you showed?
The pack band is a great option. Yes, it will work with it. The pack band, the one thing I'd say about the pack band, different than the Juxtalight foot and ankle piece, is that it has to be assembled. It doesn't come pre-assembled. So if you know how to assemble it, it's an awesome tool. It's probably my favorite foot piece that we've got because it's really effective. You can get it to fit really well, but it involves a little customization. Whereas the Juxtafits, they come ready to go. Stick your foot in it. Velcro's already sewn in, all that stuff. So I do like them both, but it depends on if you're able to fabricate it or customize it. Definitely go with the pack band. It's a great option.
All right, fantastic. It looks like, we're all out of questions, but we're also all out of time here. So I want to thank Bryan very much for your time here, for your presentation. We really appreciate it. And yep, you can, as we mentioned before, any of these Circade products, or really most products made by Medi, you can purchase at medicalmonks.com. Please contact us with any questions you might have after this. And thank you so much for coming. And thank you, Bryan.
Cool. Thank you so much. I appreciate it.